Hello, everyone. I am Dr. Emily Morse, and today I want to speak to you about something that can deeply affect your health, your peace of mind, and even your sleep. If you or someone you love is living with diabetes, what happens during the night may hold more importance than you think. Too often, nighttime symptoms are brushed off as random discomforts, aging quirks, or just part of a bad night's rest. But the truth is, many of these signs are your body whispering for attention. Ignoring them might not only make your sleep worse, but could signal more serious imbalances in your blood sugar or early signs of diabetic complications. Over the next few sections, I will walk you through the 10 most common and important nighttime signs that should never be ignored if you are diabetic or at risk of developing diabetes. These signs may seem harmless at first. You may think they are just something that happens to everyone from time to time. But when you understand the science behind these symptoms and how they connect to your metabolic health, it becomes clear why taking them seriously is an act of self-respect and prevention. Each sign we explore will help you better understand your body and, more importantly, how to support it with knowledge, awareness, and care. My goal is not to scare you, but to empower you. Because when we catch things early, we can act early. And that gives you the chance to sleep better, feel better, and live with more confidence. Part 1. Frequent nighttime urination. One of the earliest and most overlooked signs of blood sugar imbalance during the night is frequent urination. Many people think it's just a part of getting older, especially for those over 50. But when your bladder starts waking you up 2, 3, or even 4 times a night, it's time to listen more closely. Here's what is really going on. When your blood sugar levels are too high, your kidneys work harder to filter out the excess glucose. The body's way of getting rid of that extra sugar is to push it out through the urine. This creates a higher volume of urine, which fills the bladder faster and wakes you up. It is your body's way of trying to protect itself. But it comes at the cost of your rest. Now, why is this important? Interrupted sleep has consequences. It increases your cortisol levels, which can raise blood sugar even further. It also weakens your immune system, slows your metabolism, and increases insulin resistance over time. That means your body becomes less efficient at managing sugar the next day, creating a vicious cycle that slowly builds up damage. Some people try to manage this by drinking less water at night, but the real solution is not about reducing fluids. It's about improving how your body handles sugar. Tracking your blood sugar 2 hours after dinner, keeping carbs moderate at night, and adding fiber-rich vegetables or healthy fats to your dinner plate can help reduce the spike that leads to overnight urination. If you're experiencing this symptom, do not ignore it. It may be a subtle nudge from your body asking for better blood sugar support. And the good news is, with the right strategies, this is one of the easiest symptoms to improve. Part 2. Waking up thirsty or with a dry mouth. Let me ask you a simple question. Do you often wake up in the middle of the night feeling parched? Maybe your mouth is dry, your tongue sticks to the roof of your mouth, or you feel an intense need to drink water before falling back asleep. If so, this is not just due to sleeping with your mouth open or dry bedroom air. It may be a deeper issue tied to your blood sugar levels. This symptom is often the twin of nighttime urination. When your blood sugar is too high, your body uses fluid from tissues to help flush excess glucose through the kidneys. That constant flushing process leaves you dehydrated, even as you are drinking more. It creates a cycle of thirst and urination that disrupts your sleep and leaves your body imbalanced. Dry mouth is also more than just discomfort. Saliva plays a critical role in digestion, in oral health, and in protecting the gums and teeth. When saliva is reduced, Your mouth becomes a breeding ground for bacteria. This increases your risk of cavities, gum disease, and infections. For older adults, especially those with diabetes, that can lead to serious complications that affect heart health and immune response. Now here's something I want you to know. Waking up thirsty is not normal. It is a subtle signal from your body that your blood sugar may have been spiking late at night. Often, it's the result of a high-carb dinner, sweet desserts before bed, or snacking late into the evening. Even a glass of wine can push your blood sugar higher than you expect. One of the simplest things you can do to reduce this is to avoid eating at least 2 hours before bed. Another is to test your blood sugar before bedtime and compare it to your morning reading. This pattern can reveal more than your doctor might catch in a single lab test. So the next time you wake up with a dry mouth, don't just reach for your water bottle. Ask your body what it's trying to say. And more importantly, give it what it truly needs: balance. Part 3, night sweats and waking up drenched. Now let's talk about something most people find uncomfortable to mention, but very real for many diabetics. Have you ever woken up in the middle of the night completely soaked in sweat? I'm not talking about a slightly damp pillow. I mean sweat-soaked sheets, drenched pajamas, and a pounding heart. Night sweats are one of the most misunderstood warning signs, and for people with diabetes, they can be deeply significant. Most assume it is just menopause, stress, or a warm room. But there's a much more important explanation. It's called nocturnal hypoglycemia, which means your blood sugar is dropping too low during sleep. This can happen for several reasons. Sometimes it's due to diabetes medication, especially insulin or sulfonylurias, working too aggressively. Other times, it's because of skipping dinner, over-exercising, or drinking alcohol before bed. Your body senses the drop in glucose and responds by triggering stress hormones like adrenaline and cortisol. These hormones cause you to sweat, wake up suddenly, feel shaky, anxious, or even confused. Let me tell you something crucial here. Nocturnal hypoglycemia is not just an inconvenience. Repeated low blood sugar episodes during sleep can increase the risk of heart arrhythmias, poor brain function, and even long-term cognitive issues. That's especially true for older adults whose blood sugar regulation is already fragile. One way to protect yourself is to have a consistent nighttime routine. Avoid eating high-sugar or high-carb foods before bed. If you are on blood sugar medications, make sure the dose and timing are appropriate. Some people benefit from a light protein snack in the evening to stabilize blood glucose levels overnight. Things like a spoonful of nut butter or a boiled egg can do wonders. And if you ever wake up with intense sweating, especially paired with confusion or shakiness, don't ignore it. Keep a glucose monitor by your bed. Measure your sugar. Write it down. These episodes are your body's cry for help, and they deserve your full attention. Part 4, frequent nighttime urination. Here's a question I often ask my diabetic patients. How many times do you get up at night to use the bathroom? If your answer is more than once or twice, it's time to pay close attention. Frequent nighttime urination, known medically as nocturia, is not just about aging or having a small bladder. For people living with diabetes, it can be one of the earliest and most consistent signs that something deeper is out of balance. Let's break it down. When your blood sugar is elevated, your kidneys go into overdrive trying to flush out the excess glucose from your bloodstream. Glucose pulls water with it, leading to increased urine production. That's why many diabetics find themselves waking up multiple times a night just to pee. But here's the more important part. If this happens often, your sleep gets disrupted. You may not enter the deep stages of rest that your brain and body need to repair, regulate hormones, and maintain insulin sensitivity. The result? A vicious cycle. Poor sleep worsens insulin resistance. Insulin resistance increases blood sugar. High blood sugar keeps you up all night going to the bathroom, and around it goes. In older adults, nocturia also raises the risk of nighttime falls. Imagine walking half asleep to the bathroom on stiff joints or weakened legs. A misstep could lead to serious injuries, fractures, or even hospitalization. So what can you do? Start by managing fluid intake. Drink most of your water earlier in the day and reduce consumption after dinner. Avoid caffeine and alcohol in the evening. These are natural diuretics that encourage more urination. Second, be mindful of your blood sugar before bed. If you're waking up to urinate frequently, try checking your glucose at bedtime. And again if you wake up. High overnight sugars could be the culprit. Also, make sure your medication timing is appropriate. If your doctor has prescribed you diuretics for blood pressure, consider discussing whether taking them earlier in the day might reduce nocturia. And remember this, while peeing at night might seem harmless, it is often a loud whisper from your body telling you that blood sugar regulation needs attention. Part 5. Sudden night sweats. Let me ask you this. Have you ever woken up, drenched in sweat, heart racing, sheets soaked, and unsure why it happened? You're not alone. For many people with diabetes, sudden night sweats are more than just a discomfort. They are a warning sign. What's happening here is often related to blood sugar dipping too low during the night, a condition called nocturnal hypoglycemia. Your body is incredibly wise. When glucose drops too low while you sleep, it sets off a chain reaction. Stress hormones like adrenaline and cortisol surge to help raise your blood sugar. But these hormones also stimulate your heart, raise your blood pressure, and activate your sweat glands. The result? You wake up in a panic, sweating, shaky, disoriented, sometimes even confused or nauseous. Now, why does this matter? Because nighttime hypoglycemia is dangerous. It can go unnoticed for hours, leading to severe lows that may result in seizures, unconsciousness, or even cardiac stress. For older adults, especially those taking insulin or certain oral medications, the risk is even greater. What causes these night crashes? Several factors. You may have eaten too little for dinner, or exercised more than usual that day. Or perhaps you took your evening diabetes medication without adjusting your food intake. All of these can push glucose too low in the early morning hours. So what can you do? First, start tracking. If you experience night sweats regularly, consider checking your blood sugar around 2 or 3 a.m. for a few nights. That's when many lows occur. If it's under 70 milligrams per deciliter, that's a red flag. Second, adjust your routine. Eat a small, balanced bedtime snack that includes both protein and complex carbs. Something like a slice of whole grain toast with almond butter or a few apple slices with a small piece of cheese. This can help stabilize glucose throughout the night. And finally, always consult your healthcare provider if these episodes happen more than once. Your medication dose or timing may need to be adjusted. Remember, your body is always speaking to you. Night sweats are not just a nuisance, they're a signal. Listen closely and you'll be able to respond with wisdom instead of fear. Part 6. Restless leg syndrome or tingling sensations. Have you ever laid in bed at night, utterly exhausted, only to find your legs twitching or tingling, refusing to settle down? Maybe you feel the need to keep moving them or the sensation makes it impossible to fall asleep. This is not just an annoyance. For people with diabetes, it can be a sign of something much deeper. What you may be experiencing is restless leg syndrome or the more concerning issue of peripheral neuropathy. Both can show up at night, and both are commonly linked to poor blood sugar control. Peripheral neuropathy is one of the most common complications of diabetes. It occurs when high blood sugar over time damages the small nerves, especially in the legs and feet. These nerves control sensation and movement. When damaged, they begin to misfire. That misfiring leads to burning, tingling, numbness, or that unbearable crawling feeling beneath the skin. In the early stages, it may only occur at night. Why? Because at night you're still, you're quiet. There are fewer distractions, so the sensations become more noticeable. Now, restless leg syndrome may feel a bit different. It creates an urge to move your legs, often accompanied by odd or uncomfortable sensations. The relief only comes when you shift or stretch, and it tends to strike hardest during the night or periods of rest. Either way, these symptoms are your body's way of alerting you. When nerves are irritated or damaged, they lose their ability to transmit clear messages. And it is not just about discomfort. Over time, neuropathy can lead to muscle weakness, coordination issues, and even open wounds that won't heal. So what can be done? First, the most important step is blood sugar control. Keeping your levels within a healthy range slows the progression of nerve damage and may even reverse some symptoms. Second, consider a nerve-supportive supplement such as alpha-lipoic acid, vitamin B12, or magnesium, but only under the supervision of your healthcare provider. These nutrients support nerve repair and may help ease nighttime discomfort. Third, create a gentle evening routine. Stretch your legs, massage your feet, use a warm compress or take a bath with Epsom salts to calm irritated nerves before bed. And finally, stay active during the day. Moderate movement like walking or yoga helps improve circulation and reduce the nighttime buildup of discomfort. If you find these sensations are worsening or impacting your sleep regularly, please do not ignore them. Speak with your doctor. Early intervention can prevent further nerve damage. Part 7. Chest discomfort while sleeping. Let me ask you something very important. Have you ever been woken up by a strange tightness in your chest, a sense of pressure, or even slight pain? Did you try to shrug it off, thinking maybe it was just indigestion or the way you were lying? I understand that instinct, but as a doctor, I need to be very clear. If you have diabetes, any nighttime chest discomfort must be taken seriously. Here is why. People with diabetes are at a significantly higher risk for cardiovascular disease. Over time, elevated blood sugar damages the blood vessels and the nerves that control the heart. That damage may not show up clearly during the day, but at night, when your heart rate slows and the body enters a relaxed state, hidden signs can emerge. Chest discomfort while sleeping may be a silent warning. Sometimes people with diabetes experience what we call silent heart attacks, where there is no dramatic pain or sudden collapse. Instead, there might be a sense of pressure, shortness of breath, mild nausea, or even a strange fatigue. These symptoms can surface at night and then disappear by morning. That is what makes them so dangerous. You may think it was just a bad dream, gas, or anxiety, but I encourage you not to ignore these signs. Now let me be specific about what to watch for. If you experience any of the following symptoms while lying down or during the night, I urge you to speak to your doctor immediately. A feeling of pressure, tightness, or squeezing in the chest. Pain that radiates to the shoulder, arm, neck, or jaw. Unexplained shortness of breath or wheezing. Cold sweats, especially during sleep. Sudden nausea or dizziness, a fluttering or racing heartbeat without reason. These could be signs of reduced blood flow to the heart, especially in someone already at risk due to diabetes. Your nighttime is meant for repair and healing, not silent suffering. And when your body whispers with these symptoms, it is trying to warn you before something more severe happens. I often remind my patients that diabetic heart disease does not always follow the rules. You might not have dramatic symptoms, but the underlying danger is very real. So what can you do? First, take any nighttime chest discomfort seriously, even if it is mild. Do not wait. seek evaluation. Second, make sure you are monitoring your blood pressure, cholesterol, and blood sugar regularly. Third, avoid heavy meals before bed, reduce stress in the evening, and stay physically active. And finally, follow up with your doctor if you are on heart medications to ensure they are working as intended. Prevention is the most powerful tool we have, especially when it comes to heart health. Part 8. Excessive nighttime urination. Let me ask you something that might feel a little personal, but it is one of the most common concerns my patients share. Are you waking up more than once a night to go to the bathroom? Does your sleep get interrupted by the urgent need to urinate, sometimes 2, 3, even 4 times a night? If so, I want you to know you are not alone. And more importantly, it is not just about getting older. In people with diabetes, excessive nighttime urination is often a signal that something deeper is out of balance. The medical term for this is nocturia, and while it can happen for many reasons, in diabetics it usually points to poor blood sugar control. When your blood sugar levels are high, your kidneys work harder to filter and flush out the excess glucose. That extra sugar draws water with it, and the result is increased urine production. Now, during the day, you may not notice it as much. You're up and moving, but at night, when your body should be resting, those high sugar levels force your kidneys to stay active. And you are the one paying the price by getting up again and again, disrupting your sleep cycle. Why does this matter? Because when your sleep is disturbed frequently, your body cannot fully rest, recover, or heal. Sleep is when your hormones regulate, when your blood pressure drops, when your immune system strengthens. If your rest is being stolen by your own body trying to flush out excess sugar, your health suffers on every level. And I know some people try to just drink less water before bed to avoid waking up, but that is not the root of the problem. This isn't about drinking too much water. This is your body saying, "There is too much sugar here. I need help." In some cases, excessive urination at night could also signal the beginning of diabetic kidney disease, especially if it is accompanied by foamy urine, swelling in your feet or ankles, or high blood pressure. So what can you do about it? First, check your blood sugar patterns. If you are spiking in the late afternoon or evening, that could be part of the cause. Second, speak to your doctor about your A1C levels and whether your medications or meal timing need to be adjusted. Third, avoid heavy carbs late in the day and instead opt for high fiber, low glycemic foods at dinner. Finally, stay consistent with your medication and hydration. Your kidneys function best when supported properly, not stressed by sugar overload. One last reminder. If you are waking up often to urinate at night, please don't ignore it or dismiss it as just age. It is a clear sign from your body that something needs attention. Part 9. Tingling or burning feet at night. Let me paint a picture that may feel all too familiar. You are lying in bed, the lights are off, and the house is quiet. But instead of slipping peacefully into sleep, you feel it. A buzzing, a prickling, or even a burning sensation in your feet. It creeps in slowly at first, then grows stronger. And before you know it, you are tossing, turning, rubbing your feet against the sheets, or reaching for something cold to soothe the sensation. This is not just discomfort. It is not your imagination. This is a classic sign of diabetic neuropathy, and for many people, it shows up most clearly at night. So, why does this happen? Well, when blood sugar levels remain elevated over time, they damage the tiny blood vessels that supply your nerves with oxygen and nutrients. The longest nerves in your body run from your spine down to your toes, which is why your feet are often the first to signal trouble. And here is something important I want you to understand. This isn't just a minor irritation. When nerves begin to misfire, they can cause pain, numbness, burning, or tingling. But they also lose their ability to warn you of injury, A pebble in your shoe or a small cut on your foot might go unnoticed. That opens the door to infections, ulcers, and in severe cases, amputations. Nighttime makes it worse because when you are still and there are no distractions, your brain tunes in more to these abnormal signals from the nerves. The sensations may be mild in the beginning, just a slight tingling, but over time, they can grow more intense and painful. I have seen patients try everything from ice packs to heavy blankets just to sleep through the night, but true relief comes from addressing the root cause, which is almost always related to poorly managed blood sugar. If you are experiencing these symptoms, here is what I recommend. First, speak to your doctor about a nerve conduction test to assess the health of your peripheral nerves. Second, consider a B-complex supplement, particularly B1 and B12, which are essential for nerve repair and are often low in people with diabetes. Third, review your diet and ensure it is rich in antioxidants like alpha-lipoic acid, found in spinach and broccoli, which help protect nerves from oxidative stress. And finally, stay on top of your glucose control. The better your sugar is managed, the less nerve damage progresses, and in some cases, healing is even possible. Let me be very clear. Tingling, burning, or numbness in your feet is not something to push aside. It is a powerful message from your body. And when we listen early, we have a much better chance of protecting what matters most. Part 10. Changes in skin color on the legs or feet. Now let me ask you something personal. Have you ever looked down at your legs or feet and thought, why does that area look darker? Or perhaps, that patch looks a little shiny or purplish. If you have, please don't brush it off. Changes in the color or appearance of your skin, especially on your lower limbs, can be a quiet yet urgent whisper from your body that something serious is unfolding beneath the surface. One of the most overlooked signs of advanced diabetes is poor circulation, and your skin is often the first place to reveal it. When blood flow is compromised, your tissues are not receiving the oxygen and nutrients they need. The skin may start to change color, becoming reddish, bluish, or even taking on a bruised appearance. In some cases, the skin becomes thin and shiny, almost like it has been stretched too tightly. Why does this happen? Over time, high blood sugar damages both small and large blood vessels, making it harder for your heart to pump oxygen-rich blood to the extremities. Your legs and feet, being furthest from the heart, are most vulnerable. The result is stagnation of blood, pooling of fluid, and tissue breakdown. And if you think this is just cosmetic, I must tell you, it is far more serious than it appears. When blood and oxygen cannot reach your skin and muscles, even small injuries can become chronic wounds. These wounds can deepen, become infected, and in some tragic cases, lead to tissue death. That is how many cases of gangrene and amputations begin. Not with pain, but with a small change in skin color that was ignored. I remember a woman in her late 60s who came to me after noticing a purplish discoloration on the top of her left foot. She had no pain, just a dull ache. Within 2 weeks, she developed a sore that would not heal. Thankfully, we intervened early, improved her circulation with both medication and movement, and avoided what could have become a surgical emergency. So what should you look for? If you notice that your skin appears dusky, bluish, or darkened, especially in the same spot day after day, it is time to act. If the skin feels unusually cold, dry, or overly shiny, those are warning signs. And if the color changes are accompanied by swelling, hair loss, or slow healing sores, the alarm is ringing loud and clear. Here is what I suggest. First, get your ankle brachial index checked. This simple test compares the blood pressure in your ankle with the blood pressure in your arm and can identify poor circulation early. Second, elevate your legs when sitting and avoid crossing them for long periods. This helps promote better blood flow. Third, commit to gentle daily movement. Even a 10-minute walk each day can help improve circulation over time. And finally, manage your blood sugar like your life depends on it, because in many ways, it does. Your skin is not just your largest organ, it is your storyteller. And when it starts to change color, that story might be one of silent damage, unless you choose to listen, take charge, and write a different ending. Part 11. Waking up with a racing heart. Let me ask you something you might not have shared with anyone. Have you ever woken up in the middle of the night with your heart pounding so fast it felt like it might leap from your chest? Maybe you were drenched in sweat, breathing fast, and feeling like something was terribly wrong. If this has happened to you, especially more than once, I want you to know this is not just anxiety or a bad dream. This can be one of the more frightening nighttime signs of blood sugar imbalance. For many people living with diabetes or prediabetes, nocturnal hypoglycemia is a hidden danger. That means your blood sugar drops too low while you are sleeping, and your body, trying to protect you, responds by releasing stress hormones like adrenaline and cortisol to raise your sugar levels quickly. These hormones act like an internal alarm system, triggering your heart to beat faster, your blood pressure to rise, and your body to jolt awake. It's your body's emergency signal, a survival mechanism. But if this happens frequently, it's a sign that your diabetes is not under control. And worse, it may go unnoticed for too long. Many people who live alone might not realize these events are happening regularly. Some don't remember them in the morning at all. They just feel drained, anxious, or mentally foggy the next day without understanding why. Now, there is something else I want you to consider. A racing heart at night can also be related to autonomic neuropathy, which is damage to the nerves that control automatic bodily functions like heart rate and digestion. This is another complication of long-standing diabetes. So if your heart is acting irregularly without obvious cause, please do not ignore it. How do you know if this is something you should act on? Here are some signs. If you frequently wake with a pounding or racing heart, if you feel dizzy or disoriented upon waking, if you experience sweating and trembling in the middle of the night, or if your blood sugar is often low when you check it in the morning, then you need to take action. Here's what I suggest. Start by checking your blood sugar before bed and again during the night, perhaps around 2 or 3 a.m. a few times a week. If it drops below 70, that is too low. Have a small balanced snack before bed that includes a bit of protein and healthy fat. This helps keep blood sugar stable through the night. Avoid exercising too close to bedtime, which can increase the chance of a blood sugar dip. And finally, speak with your healthcare provider. You may need to adjust your medications, especially if you are on insulin or other glucose-lowering drugs. Waking up with a racing heart is not something to ignore. It is your body's urgent message that something inside is off balance. But with awareness, a few strategic changes, and a commitment to monitoring your blood sugar more closely, you can reclaim restful nights and wake with peace, not panic. Part 12. Final thoughts and gentle guidance for the journey ahead. We have now walked together through 10 of the most important nighttime signs that could be whispering or even shouting that something is not quite right inside your body. And if you are living with diabetes or supporting someone who is, then you understand just how deeply these nighttime disturbances can impact not only your physical health, but also your emotional well-being, your sleep quality, and your peace of mind. I want you to know this. Every sign we've talked about, from tingling feet to night sweats, from waking with dry mouth to sudden hunger pangs or a racing heart, is not something to fear. It is something to listen to, because your body is always communicating with you. It is not broken. It is not betraying you. It is simply asking for support, for balance, for nourishment, and for kindness. Here's what I have seen time and time again in my years of practice. The people who learn to pay attention to these signals, who respond with curiosity instead of criticism, with patience instead of panic, are the ones who make the most lasting progress. They are the ones who begin to heal not only their numbers, but their relationship with food, with movement, and most importantly, with themselves. So let me leave you with a few gentle but powerful reminders. Take time every evening to check in with your body. What is it asking for? Rest, hydration, a blood sugar check, a change in routine? Respond with care. Do not hesitate to speak up with your healthcare provider. You deserve answers. You deserve to be heard. Keep a log of your symptoms. Bring your questions to your appointments. Build a nightly routine that feels like self-respect. Keep water by your bedside. Prepare your sleeping space to be calm, cool, and supportive. Let your final thoughts before bed be filled with gratitude, not worry. And most of all, know that you are not alone. Millions are walking this path beside you, and there is support, there are answers, and there is real healing waiting for you, often starting with the smallest of choices. If you found this video helpful, please press the like button and let me know in the comments which nighttime symptom surprised you the most. Do not forget to subscribe and turn on notifications so you never miss a video that could change your health for the better. Stay informed, stay kind to your body, and I will see you again in the next video.